My name is Arlene Ononiwu and I'm a fourth-year biomedical science student affiliated with Lady Eaton College. The title of my presentation is Building Technologies for Disease Detection. To the application of proteins and technologies for the detection of amyotrophic lateral sclerosis. Now, what is amyotrophic lateral sclerosis? It is a neurodegenerative disease that destroys motor nerve cells and degenerates voluntary muscles, which leads to cognitive deficits such as memory loss and language problems. With ALS, there is often accumulation of tRDNA binding protein 43. When TDP43 converts from a liquid-like substance to a gel-like substance, there is excess accumulation in the cytoplasm of nerve cells. This interferes with normal nerve cell processing. Presented before you are 3 individuals well known in their respective career paths that were diagnosed with ALS and have unfortunately passed away. 80% of individuals diagnosed with ALS are often told they have 2 to 5 years left to live. Ms. Ryder passed away 6 years after diagnosis, Mr. Martin 2 years after diagnosis, and Dr. Hawking 55 years after. All 3 individuals first reported experiencing muscle weakness in the hands and legs, which then spread to the rest of the body. ALS is in men than in women, with a ratio of 3:1, and there is currently no effective treatment or cure. It is the most common cause of neurological death in Canada, with over 3,000 Canadians currently living with ALS. A study done in 2016 projected an increase in the number of individuals across 9 regions of the world that would be living with ALS from 2015 to 2040. Now, the purpose of my research is to apply new diagnostic tools to detect the ALS protein using electrochemical measurements, which can be observed on a display monitor. My project employs the use of a sandwich method where a protein sensor binds to a secondary molecule, and then it is tested whether the secondary molecule can bind the ALS protein. So first, a protein sensor or film is made on the surface of a gold electrode. A gold electrode is used because it is chemically unreactive. The protein sensor undergoes binding process with the secondary molecule, which is then exposed to the ALS protein for detection. Each can be measured and observed in the form of a graph. So far, I have successfully stabilized the protein film onto the gold surface. The 2 overlapping cyclic voltammetry patterns shown on this graph are measurements of the protein film before and after 1 hour. This indicates a well-made and stable protein sensor. Future work entails the assessment of the binding characteristics of the secondary molecule and the ALS protein. The successful completion of my project would add to the healthcare applications for the measuring of ALS protein levels to detect and track ALS progression.